This session, Making Sense of Student Assessments, is aligned to the Pennsylvania Department of Education Paraeducator Competency 4, Assessments. Our focus will be on understanding the different types of assessments used in schools and how paraprofessionals play an important role in supporting assessment practices. Our goal is to build a strong foundation and practical understanding, not to become assessment experts overnight. Throughout this session, think about what assessments you already see in your school, how data impacts instruction, and how your role supports student success. By the end of this session, you will have a gained understanding in the purpose of different types of assessments, be able to distinguish between universal screening, diagnostic, progress monitoring, and outcome assessments. Recognize how paraprofessionals support the assessment practices. As we go through this session, think about which assessments you are most familiar with and where you may already support these practices in your daily work. Take a moment to think about assessments you've seen in classrooms or interventions. Pause the video now and make a list. Restart the video when your list is complete. Pause video now. On your list, you may have included reading checks, fluency passages, math fact probes, classroom quizzes, benchmarks, assessments, state testing. You may notice that assessments come in many forms. Some are short and frequent, while others happen only a few times a year. In this session, we'll learn that each assessment serves a different purpose. Assessments are tools to inform instruction, not just measure performance. They help us understand what students need and how we can best support their learning journey. Your experience matters. There are some legal requirements regarding assessments. IDEA, Individuals with Disabilities Act, outlines that we need to use multiple means of assessments to make determinations and develop a student's individualized education plan, or IEP. Within the IEP are goals and objectives. Assessments drive the IEP, specifically goals and objectives. Assessments and the data allow us to set measurable, realistic, meaningful goals for students. One important idea to remember throughout this session is assessments are tools to inform instruction, not just measure performance. Assessment data helps educators answer questions like, what skills does the student already have? What skills need additional support? Is instruction helping the student improve? The goal is not simply to collect numbers. The goal is to use information to make instructional decisions that help students succeed. As paraprofessionals, you help support this process through accurate implementation, observation, and data collection. Assessment plays a crucial role in maintaining accountability within our educational framework. It provides us with accurate and reliable data to track student performance and progress over time, ensuring that each student's needs are being met effectively. We cannot simply rely on our memory or how we think they are doing. By consistently collecting and analyzing assessment data, we can identify trends and patterns in student learning. This allows educators to make informed decisions about instructional strategies and interventions, ultimately enhancing the educational experience for all students. In my opinion, this is the most important. It tells us if what we are doing for the student is working. It will tell us if we should keep going, but also tell us if they are not making the expected progress. We need to adjust, change, alter what we are doing so we can see students progress. Today we'll focus on 4 major types of assessments commonly used in schools: universal screening, diagnostic assessments, progress monitoring, and mastery data. Each type has a different purpose, different timing, different uses for instruction. Understanding these differences will help you better support students and instructional teams. Universal screening assessments are designed to identify students who may be at risk for academic difficulties. Key points regarding universal screening. They're given to all students, usually administered 3 times per year. They help schools identify students who may need intervention. Examples include DIBELS, Acadians, benchmark reading assessments. These assessments are quick and efficient. They are not meant to provide detailed information about every skill. Paraprofessionals may assist by preparing materials, helping administer assessments, supervising students, recording responses. Accuracy and consistency are very important. Next is diagnostic assessments. They help determine why a student is struggling. If a screening assessment identifies concern, diagnostic assessments provide more detailed information about specific skill gaps. Examples may be a phonics inventory or an error analysis, decoding assessments, reading comprehension diagnostics. These assessments help teachers answer which skills are weak, what instruction should happen next. For example, a screening may show a student is below benchmark in reading. A diagnostic assessment may reveal difficulty with vowel teams or blending multisyllabic words. Paraprofessionals may support logistics or data collection, but typically do not independently interpret the results. Progress monitoring assessments track student growth over time. These assessments are short, frequent, and focused on a targeted skill. Examples might be weekly fluency passages, skills probes, math fact checks. The purpose is to answer, is the intervention working? Teachers and intervention teams use this data to continue instruction or adjust interventions or increase support intensity. Paraprofessionals often play an important role by administering probes, timing assessments, recording scores accurately, following assessment procedures consistently. Again, consistency is critical because inaccurate data can lead to incorrect instructional decisions. Mastery assessments, sometimes also referred to outcome or summative assessments, evaluate overall learning after instruction has occurred. These assessments can happen at the end of a unit, at the end of a semester, or at the end of a school year. These assessments are outcomes driven and provide a view of student learning after instruction is complete. These assessments help educators understand whether instructional goals were met and inform future instructional needs. Now that we've covered the 4 types of assessments, we're going to practice identifying assessment types. Throughout the next few slides, you'll be answering the question, what type of assessment is it, and what is the purpose? Feel free to pause the video at any time if you need additional time to think about what type of assessment it is and what the purpose is. A student's reading fluency is checked weekly. What type of assessment is this? What is the purpose? Pause video now if you need more time. The correct response is progress monitoring, and the purpose is track growth and intervention effectiveness. All students complete a reading benchmark assessment in the fall. What type of assessment is this? What is the purpose? Pause video now if you need additional time. This type of assessment is a universal screening, and the purpose is to determine what students may need areas of additional support. A teacher gives a phonics inventory after noticing decoding concerns. What type of assessment is this? What is the purpose? This is a diagnostic assessment. It will help to determine which skills are weak, what additional instruction should happen next. Students complete an end-of-unit test. What type of assessment is this? What is the purpose? This is considered outcome assessment or mastery data. Did the students learn the content? Do I need to review content with them? Paraprofessionals play an important role in assessment systems. Responsibilities may include administering structured probes, recording data accurately, organizing materials, maintaining confidentiality, supporting intervention implementation. It is important to remember paraprofessionals support data collection, but normally do not independently interpret assessment results or make instructional decisions without teacher guidance. Your consistency and attention to detail directly support student success. Key takeaways. Different assessments serve different purposes. Assessments help guide instruction and intervention. Paraprofessionals are a valuable part of the assessment process. And assessments connect with your daily responsibilities. As we wrap up, please reflect on your learning today. Think about 3 types of assessments you learned about today, 2 ways you support assessments, and if you still have any questions, please feel free to reach out to Blessed IU 17. Thank you. Remember, effective assessment practices help schools make informed decisions that improve outcomes for students, and we do appreciate your commitment to supporting students on their journey. Your dedication makes a difference every day.